The U.S. death toll now at 11. Officials in California announced the first fatality in that state yesterday, saying it is likely linked to a cruise ship that visited Mexico. The House yesterday passed an $8.3 billion emergency spending bill to fund the response to the coronavirus outbreak. The Senate is expected to vote on the measure later today and send it along to the president's desk. All of this comes as new cases are being reported in cities across the U.S. We're joined now by Anjali Kamlani, who's been tracking the outbreak for us. Anjali, what's the latest?
Yes, Julie. So we know that the numbers are now more than 96,000 cases worldwide, as well as more than 3,200 deaths. In the U.S., that number is more than 160 in terms of cases and 11 deaths. So this is, increasing the concern that we already had and health officials have already warned about. The U.S. response is in play. We know that, the coronavirus White House task force is working on the response and trying to coordinate exactly where they need all of this to go. In terms of prioritizing tests, there's talk about, making sure that where the clusters are already existing, which is largely on the West Coast, that the tests do, in fact, get to go there first from the CDC, as well as commercial tests now coming online. We know that Quest Diagnostics just announced that they're going to be doing that as well. So really, an ever-flowing, increasingly just flowing situation, rapidly evolving in terms of what the response will be. We know that Vice President Mike Pence yesterday did say that these tests would be covered as an essential health benefit, but we're hearing from insurers that that's not necessarily true just yet. They still need to have more information to figure out whether or not this is going to be something that patients will have to pay for out of pocket.
Anjali, we want to bring in Dr. Howard Foreman. He's the practicing emergency department radiologist at Yale New Haven Hospital. He's also a professor in the Yale School of Public Health and in the Yale School of Management. Dr. Foreman, thank you for being with us. People obviously are nervous. Some are scared because we just don't know how bad this is going to be, and some are assuming the worst. What has changed in, say, the last week? There was the article yesterday that this virus has already mutated and that the cases we're talking about are the more virulent mutated strain of the coronavirus. Can you enlighten us as to what we truly face?
I think we don't know a lot, and that's the thing about sort of a novel virus like this, is that we have past experience with other viruses, we have past experience with other epidemics over time. We know our vast experience with the influenza virus, for which we are able to vaccinate at fairly high rates in this country. Even if it's not effective, it still mitigates the impact on individuals and on the outbreak. And here we're dealing with something completely novel, where the data is coming in real time, and we don't have a very good sense for things, simple things like lethality, its infectiousness, and really its current prevalence in the population. And particularly for the United States right now, I think that's the biggest challenge, is that even though, as you described it, we see hotspots sort of in California, New York, and a few other places, smaller, particularly Seattle, we have big swaths of the country where this, almost certainly exists, but we're just not testing for it yet.
Dr. Foreman, it's Julie here. I know that you teach healthcare management, among other things. How do you think the healthcare system in this country is both currently managing and equipped to manage outbreaks here? And what do you make of the leadership that we are seeing from the CDC, for example?
I think we're learning very quickly just how fragile our public health infrastructure is. We have a lot of great people working both on the ground in healthcare and in public health, but in a situation like this, where we seemingly had several months lead time to prepare for this, and where even a few weeks ago everybody had great hope that we would have on-the-ground testing and that we would be able to put in place containment measures that could potentially do what seemingly has been done in China here, and now we're allowing this to really explode, is the unfortunate word of the day. All over the country, if you look right now in Europe, there are over 4,000 cases. It wouldn't surprise me if we have many more than that in the United States, but we haven't even begun testing. And until you can start testing, you don't even know where the areas of highest intense treatment and containment should be occurring.
Dr. Foreman, Anjali here. I know that we've seen just, the outbreak of, or the the outflow of testing and how that's really getting prepared right now. We know that Quest just announced that they're going to be getting theirs online. So with that spread and with the expectation that these cases are in fact going to increase, one of the concerns remains the long-term care and nursing homes, and we know that that's where the majority of the vulnerabilities are. So what are your thoughts about that, and how CMS is rolling out the increased auditing, increased look at them?
Yeah, look, my biggest concern over the last week basically has been that while the CDC, even with the restrictive criteria, had said that we can consider testing for all patients that have severe pneumonia and fever that is otherwise unexplained by influenza or other causes who are admitted to the hospital, which is another way of saying severe pneumonia. This is a relatively small set. This is probably somewhere between 10 and 20,000 patients in the hospital any given time during flu season. But we're not even testing those. It would surprise me if we've tested 5% of that population, and maybe we should have tested 30 or 40%. Until we go out there and really do diligent testing in high potential impact areas, as you mentioned, nursing homes, but even more so inpatient facilities where patients are admitted with unusual pneumonias, we have no idea where the real hotspots are. And until we know where the hotspots are, it's very difficult to be able to either reassure patients, which may very well be the case, for us to be able to say to people, look, we've done a very thorough screening of your area, we've checked the schools, we know there's no outbreak. That would be very reassuring to people. And unfortunately, because we haven't done that, people are getting more and more nervous every day and more panicky every day, and it's becoming harder and harder to reassure them when we see every day tens if not dozens of cases now coming out and more regions being affected.
Yeah, so just on the testing, which, the preoccupation with the lack of the testing equipment at the present time, is there any idea or estimate in your mind as to when we're going to get to a point where there's a sufficient amount of testing equipment available?
Yeah, so I think the answer to that is probably in 2 or 3 weeks we'll be at a level where we can really provide sufficient testing as you've described it. But right now, the most important would just be to do the lowest hanging fruit. Go into the areas where there are undiagnosed cases, but where you have high suspicion, and test them. We need to be testing people that have had exposures, not in Korea or China, but people have had exposures locally who are presenting with fever or cough or both, and who have concerns. We need to be able to reassure people, because right now there are many people that are self-isolating and being quarantined, and we're not even testing them.
All right, Dr. Howard Foreman, professor at the Yale School of Public Health and at the Yale School of Management. We appreciate your insight here on The Move.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.